I guess we should go back to defining what atrial fibrillation is without getting into too much EKG stuff. What is atrial fibrillation and what causes it?
Yeah, that's a great one. So atrial fibrillation is a disorganized rhythm in the top chambers of your heart, the atria. So a normal heartbeat is, when the atria initiate the heart impulse, they contract. The electrical impulse in the blood then transfers to the bottom pumping chambers, the ventricles, and they contract sequentially. So the contractions are mechanical. They happen in sequence because the electrical signal is coming to them in sequence. Top chamber first, small pause, bottom chamber. So that's the normal heart impulse. When electrical activity in the top chamber becomes chaotic, which it can be, the atrial tissue can support cyclones, hurricanes of abnormal electrical activity where the top chamber is really beating at 300, even 600 beats per minute. And the activity in those chambers becomes completely disorganized when that's happening. We call that atrial fibrillation. If you were to see that in an open heart patient, say during cardiac surgery, you would say that the atria look like they are a bag of worms. It just looks like this seething mass of muscle, which really has no organized contraction at all. The blood can then, whatever electrical impulse bombards the bottom chamber gets filtered through the AV node. It will cause the bottom chamber to beat faster usually, but also irregular and irregularly irregular because it never knows what impulse is going to make it through from the top chamber. And as a result, the impulse in the bottom chamber is this stuttering action. And we call that the irregularly irregular rhythm of atrial fibrillation. And that's how you diagnose it. You see that pattern of activation of the QRS complexes, which is the activity in the bottom chamber of the heart. And that tells you that will be atrial fibrillation that is acting in the top chamber.